speechifying to beat the band, it's the Medicare for the Lazy Man podcast. The podcast that often sounds like Yoko Ono warbling. He's sick of paying dues to the Podcasters Union. It's Medicare expert Doug Jones.
Hello, everybody. Welcome to another thrill-packed episode of the Medicare for the Lazy Man podcast. You might have heard my Canadian nephew, Drew McMillan, tell you who I am, so I can't keep it a secret any longer. My name is Doug Jones. I am here to help you enjoy the prospect of entering the world of Medicare. Most people that are already in that world enjoy the prospect of being there, except for those who are running afoul of their health insurance plan because they chose in a careless way. And I'll tell you how to avoid that. That's what I do for a living, is I help people avoid problems, and I help people choose the best health plan for them. The best health plan for them may not be the very cheapest plan, but I know how to make it a reasonably inexpensive plan, and I know how to help them pick the plan that is going to pay the bills if Medicare problems or medical problems arise. So that's what I do for a living, and I help people do that stuff because I've written a book called Medicare for the Lazy Man 2025. If you were to go to barnesandnoble.com or amazon.com, you'd be able to purchase Medicare for the Lazy Man 2025. You'd be able to thumb through it and see the highlights of my recommendations right up front, right in the very beginning of the book. I list the three things that I think are most important for anybody that is contemplating a transition to Medicare. And those three things are yours to be had if you want to purchase the book. They're not difficult to understand, but they're alien to many people because their insurance agents do not always agree with my recommendations. Now, it'd be interesting to find out what they have selected for their own Medicare coverage, because that tells the tale. And in the meantime, I recommend that people purchase the very, very best coverage available, and that they pay the very least amount of money possible for that. And I can help people do both things. Once you have looked in the book, you'll find that my email address is there waiting for you. And when your Medicare time is approaching, when you're just 2 or 3 months out, you should send me an email or go to medicareforthelazyman.com and fill out the questionnaire. All you have to do is click on the yellow button that says send me a quote. And that's exactly what I do. I send you a quote. I do not call you with the quote or make you interact with me in any way, shape, or form unless you want to have that interaction. I'm not in business to bother people. I'm in business to show them the light. And I show them the light in such a way that when they accept my recommendations, they are typically happy about it for the rest of their time in Medicare. At least that's been my experience. I should also mention, too, that I have a second book out that will help that same group of people select the very best drug plan for themselves. It's a step-by-step, easy-to-follow guide, and I'm looking forward to having everyone pick out their own best drug plan without any annoying insurance agents being involved. That's the best part of the whole thing. You might have to pay a few bucks for the book, but you can avoid having guys like me leaning over your shoulder and breathing down your neck and helping you pick out your drug plan. You can do it yourself. It's a simple process when you know what the steps are. And that's what my other book is all about. It's called Medicare Drug Plans, a simple DIY guide. Both of those are at amazon.com, so that would be where I would suggest you go to get the full library of Medicare books. And if you want to get the full scoop on what Randy Carson's been up to, you've come to the right place for that. Randy, what's been going on in your life lately?
Well, while you were doing your intro, there was a couple thoughts just rattling through my mind. I just, this is probably just a little bit of information for the audience. One of my jobs as the technical guy behind all this podcast, some of the other things, one of my other jobs, it's not official, but Doug has always told me, make sure you dream up some good stuff, things that really, algorithms and, abbreviations and all kinds of stuff that stick in people's minds. So I did. But I haven't used, there's this one that I've got on my list of potential usages that I haven't used for a while. And I was wondering if Doug still liked this one. Part C is the official term, I guess, for Medicare. Which one now?
Medicare Advantage plans, the evil
Yes,
twins, evil
yes.
twins.
And you know what my name for Part C is?
I I'm going to plug my ears up and ask you to shout it to the rooftops.
Metacrap.
Yeah, there you go. There you go.
So
Hits the nail
I
right on
hadn't,
the head every time.
yeah, I haven't used that for a while, so I just thought I'd trot it out there and see if you still liked it.
Well, I know that every time you mention these acronyms that you've come up with, you have stared off into space. And I always thought it was like you were going to a part of your brain that didn't get visited very often until I realized that you've got them taped on the wall up above your
I do.
screen.
I do. My whole what do they call
Your
that?
cabinets.
The overhead cabinet.
Yeah.
I've got the whole cover of that thing covered with various things, not the least of which is the NATO phonetic alphabet. I know that's important.
Well, I'll tell you what we can do is we can collect all of that information and probably write a third book about how to do a Medicare podcast because you
Yes.
have collected all of the tools needed to do a Medicare podcast.
How did Doug and Randy do it? Well,
Well,
here you
here's the
go.
secret. Yeah, first of all, get the NATO phonetic alphabet so that
Yes.
people understand whether you're saying B or D or whatever.
Yeah,
You
yeah,
can use
exactly.
Bravo and Alpha and all that stuff. Well, that's pretty darn cool that you came up with that one because that is one of the harder hitting, more to the point acronyms that you've been using, that meta crap. And it's
Yep.
accurate.
It's about as hard hitting and as truthful and straightforward, unadorned as it could be.
Yes, absolutely. So, what I think we ought to do is maybe get right down to it because these people did not come here to be entertained. They came here to be forced to learn Medicare stuff. So we start.
I can hear the whining now.
Yeah, I know, but the doors are locked. They're not going to get out until they've
I
been
know. I
uh,
know.
ingested their fair share of Medicare knowledge. So the first thing I like to do is to have a Medicare Advantage Minute where I expose Medicare Advantage to the light of day and indicate to everybody why it is a bad idea to enroll in a Medicare Advantage plan when you have the opportunity to enroll in a Medicare supplement plan that is a far superior coverage and offers all the freedom of choice that one could ever want. Medicare supplement is the only way to go. But Medicare Advantage is out there, and so it's important to expose its flaws. And this is a little article about 4 reasons why Medicare or why members leave a Medicare Advantage plan, according to a study. So, Medicare Advantage members are most likely to disenroll from their health plan because of 4 main reasons: difficulty in accessing care, low plan generosity. When was a health insurance plan ever generous? Dissatisfaction with the quality of care, and the type of plan, HMO versus PPO. All Medicare Advantage plans are either an HMO or a PPO. If they're an HMO, then they cannot go outside the plan list of providers to be treated unless it's an emergency. And if it's a PPO, they can, but they're going to have to pay through the nose for the right to use other providers other than those on the list that they're handed when they enroll in the plan. So this was a study from the 2015 to 2020 Medicare Current Beneficiary Survey. The study looked at both self-reported experiences and objective measures of plan performance to identify the primary reasons for disenrollment. The researchers analyzed almost 6,200 observation years observation years. I don't know what that is. From 3,600 Medicare Advantage enrollees. I guess what they did was they observed these people for 2 years. So 3,600 people observed for 2 years adds up to almost 6,200. Must have lost a couple of them along the way. So represented a sample of over 40 million Medicare participants. The researchers observed no significant differences in the associations between Medicare Advantage plan dissatisfaction and disenrollments based on the enrollee's health status. So their health status, their health conditions, was not a factor according to these guys. And that's not what I've heard from other studies, that people leave their Medicare Advantage plans when they're sicker and they try to return to Medicare supplement plans, which offer the best possible care. Unless you're not able to show evidence of good health, because you have to earn the right to be able to enroll in a Medicare supplement plan. You can't just walk in, except for when you're turning 65 or when you leave your employer's health plan. Otherwise, you will have to earn the right to be able to have a Medicare supplement plan. So for Medicare Advantage people who leave their plans, here are 4 reasons. The first one is difficulty accessing care. People who reported trouble accessing necessary medical care were 1 1/3 more times more likely to disenroll from their Medicare Advantage plan compared to those without problems accessing necessary care. Medicare Advantage members leaving for traditional Medicare had a 3.5 times higher risk of disenrollment due to access problems compared to those switching to another Medicare Advantage plan. So people who went to Medicare supplement from the Medicare Advantage plan they had been in were very dissatisfied by comparison, 3.5 times more dissatisfied than their cohorts who went to a different Medicare Advantage plan. Number 2, low plan generosity. Beneficiaries enrolled in a lower generosity plan, which have higher out-of-pocket costs, had 1.5 times greater risk of leaving their Medicare Advantage plan compared to those in more generous plans. However, dissatisfaction with cost alone did not appear to be a significant predictor of disenrollment, as those dissatisfied with costs had only a slightly over 1 time greater likelihood of leaving. Gee, they could have expressed their percentages in a more easily understood way, couldn't they? Dissatisfaction with care quality is number 3. I think that's a pretty darn important one. People who are dissatisfied with the overall quality of care, including specialty care, were more likely to disenroll. Dissatisfaction with the overall quality of care increased the risk of disenrollment by 1.38 times. Additionally, people in plans with lower star ratings, which I've always poo-pooed the value of star ratings, but I guess once you get down in the depths, if you're down around the 2, 2.5, 3-star area, you can notice the difference. So those people had a 1.75 times higher risk of leaving compared to those in plans that were rated at 4 stars and above. And finally, the last one, number 4, plan type. For some reason, HMO versus PPO was a factor. It was more strongly associated with the risk of exiting Medicare Advantage for traditional Medicare than for switching to another Medicare Advantage plan. Those in local PPOs, I don't know. I don't understand. Enrollment in a regional PPO versus an HMO was more strongly associated with the risk of exiting Medicare Advantage and going to traditional Medicare. That seems counterintuitive to me, but what the heck do I know? So that's the deal with 4 important reasons from a study as to why people left their Medicare Advantage plans. I say it's when people see the handwriting on the wall that they're going to have problems with their medical treatment and getting it paid for by a recalcitrant Medicare supplement or Medicare Advantage plan, then that is the time to pack up and get out while the getting is good. Because once you have crossed that line into marginal or poor health, then you could find it almost impossible to get a Medicare supplement plan. It gets much more difficult than it would have been had you had you done it much sooner in the process. Medicare, your Medicare benefits 2025. It's a big, thick book of everything Medicare can think of to pay for that doctors could think of to do for you. So they're sitting around thinking up new things all the time. But as of the publication of this particular government book, and you can Google it and download it. All you need is a printer that's steam driven so it doesn't run out of juice, and a couple of trees that you grind up and make paper out of, because it is a substantial publication. And what we're going to address today is mammograms. It's a lot of people's favorite subject, but we want to make sure that there is no health risk involved. So mammograms check for breast cancer. Okay, we knew that. Part B, as in Bravo, covers a baseline mammogram if you're a woman. First of all, that's very important. If you're between 35 and 39, annual screening mammograms if you're a woman age 40 or older, and diagnostic mammograms. Those are the things that mammograms, or those are the procedures that Part B, Bravo, Part B of Medicare covers. How often? Baseline mammograms once in your lifetime. Screening mammograms once every 12 months. Diagnostic mammograms more frequently than once a year if medically necessary. And what are the costs? Well, screening and baseline mammograms, you pay nothing if your doctor accepts Medicare assignment. Diagnostic mammograms, after you meet the Part B deductible, which is $257 this year, you're going to pay 20% of the Medicare approved amount unless you've had a Medicare supplement from Doug Jones, in which case, if you have to pay that 20%, it goes right into your fund that keeps your Medicare supplement premium very, very low if you have the high deductible Plan G, which is what I recommend for almost everybody. Things to know: Medicare only covers medically necessary breast ultrasounds when your healthcare provider orders them. So if you'd like more information, I would suggest that you go to medicare.gov/coverage/mammograms. And that should lead you into just a plethora of factual information about mammograms. I say you can never do them too frequently. There are people who say, ouch. So, okay, sorry about that. But it's important to make sure that we are doing everything we can to preserve our health. I have a little thing here called Denied by Medicare. It's an article from our favorite gal, Toni. Now, Toni spells her name with an I because she's a girl. She's from down near Houston way, and she talks like it, but she says, I spell my name with I because I'm a girl. So I say back to Toni, well, I spell my name Doug with G because I'm a guy. But Toni has mail. She gets mail from people, and unlike yours truly, she will actually put these pieces of correspondence into a newspaper. And so I've got a copy of one of these more recent questions and answers that she got. So, dear Toni, because I'm assuming it's a Southerner as well, recently received a cardiologist bill for $2,000, which Medicare is refusing to cover. Despite enrolling in Medicare and its supplement for the freedom of choosing my doctor, I am now lost amid a slew of confusing regulations. I'm hoping to seek advice on what to do next, as this matter seems too complex for me to navigate on my own. Thanks, Joey. So Toni said, hello, Joey. Encountering an issue, or I say a problem, with a doctor or provider's bill is a rare occurrence, but when it does happen, there's a process that must be followed to determine whether an office visit or procedure will be paid for as a Medicare-approved service. The first step in this process is to visit www.medicare.gov and create an account to view your Medicare information and medical claims. Now, you may already have an account, but it says here if you're unable to open an account, you can wait until you receive your Medicare summary notice in the mail. Please note that the Medicare summary notice is not a bill. Medicare summary notices are sent out 4 times a year, and they contain information on submitted charges, the amount paid by Medicare, and the amount for which you are responsible. Medicare summary notices are used exclusively with original Medicare, not with Medicare Advantage or Medicare Part D prescription drug plans. So here's what you should do if you believe the claim is medically necessary and that Medicare turned it down by mistake, because that would be their primary reason if you're trying to get something done that's not medically necessary. So if you suspect an error in your Medicare billing, it's possible the medical provider may have used the wrong code when submitting your claim. This can lead to Medicare denials, but it's often easily resolvable, especially when the correct codes are used. To confirm the coding problem, ask your doctor's billing office to reach out to 1-800-Medicare. That's 633-4227, 800-633-4227, to verify the correct submission. In case a wrong code was used, request your doctor to submit the claim afresh with a correct code. If the medical provider is unwilling to resubmit the claim or believes that it was correctly coded, the next step for you is to file an appeal. Filing appeals is a straightforward process, and the Medicare summary notice has clear instructions on how to do that. Circle the specific item on the Medicare summary notice that you want to appeal. Write, "Please review" on the bottom. Sign the back and mail the original to Medicare at the address listed on the Medicare summary notice. Ensure that you file your appeal within 120 days of receiving the Medicare summary notice. In other words, don't let it sit around for 6 months. Get it done quickly. And if possible, it helps to have your healthcare provider write a letter detailing why the service was necessary. This can be sent along with your Medicare summary notice to support your claim. Always keep photocopies and records of all communication, whether written or oral, with Medicare concerning written or oral with Medicare concerning your denial. Send your appeal certified mail, and make sure you ask the post office or UPS for a signed delivery confirmation. That's according to Tony, and hopefully that will result in a satisfactory resolution of the Medicare denial of your claim. It's always kind of frustrating, but these denials and these frustrating experiences happen much more frequently with Medicare Advantage plans. This is why I advise people to stay away from Medicare Advantage plans. It's highly unusual that a situation like that would arise with Medicare, because Medicare is a much more benign arbiter of claims and their medical necessity. Now, they do check things out. This will occur occasionally just because they're looking for fraud, waste, and abuse. So they will often try to sniff out fraud, and you may get caught up in their wide net that they cast. But it's very easy to take care of it in most cases, and Tony, I think, was stated that in a very excellent way. And one of the things that I like to do also in our Medicare for the Lazy Man podcast is rattle Randy's brain around in his head. He has tortured me over the years with the trivial contests that, like what occurred on this date in AD, 1. And then I got to sit there and think about, oh, geez, where was I on AD 1? Oh, I wasn't even a zygote yet. And so I often find a trip over a quiz that Randy can help me with. In this case, it is a quiz asking for the 10 best and the 10 worst states for working fathers. Now, it says working dads, but I like to be a little more formal. So working fathers, the 10 best and the 10 worst states. Can you possibly, let's pick one of those two categories. Let's go with the 10 worst states for working fathers. Any idea what might top the list?
10.
Randy's
Okay,
thinking. Randy's got smoke coming out of his ears already.
The top worst state for
Right.
working fathers.
I think I've got him flummoxed on this one. I think I've thrown him for a loop, but we'll wait to see what his response is.
I am going to go for Georgia.
Here's my favorite part of the whole episode.
Oh, darn it.
I don't know if that made it through the filter or not. But in reality, Randy knows the pattern that we see with this company that does all of these surveys. They have a bias, and their bias shows through like a beacon in most of these things. So in this case, it's not completely political because this state is a blue state, but it is not in located in where you might have expected. So the state with the worst situation for working fathers is New Mexico, which kind of surprised me. So let me read this. The personal finance website, this is Wallet Hub, and they do have a very transparent bias with most of their what are these things? These are quizzes. They rate states based on best and worst characteristics for various things. And the states that come out the best are typically your lefty blue states, and the states that are the most horrible, hellacious place for most people to live turn out to be your red states politically. The personal finance website compared the 50 states and the District of Columbia across four dimensions: economic and social well being, work life balance, and child care and health. And then they evaluated those dimensions using 22 metrics. Geez, can we make it any more complicated? So, four things times 22 metrics, ranging from family income adjusted for cost of living to unaffordability of doctor's visits. Each metric was graded on a 100-point scale. So you got 20, let's see, you got four things times 22 metrics times 100 points each. How many options is that? That's a lot of variables.
Excuse me, Doug. Excuse me. I'll be right. I'm gonna go. I'm gonna go pound my head on the floor. I'll be right
Is
back.
that because it feels so good when you stop?
Yes, absolutely.
Well, the worst, most hellacious states in the United States for working fathers, New Mexico is numero uno on the list, and I'm thinking that that could be a bad place. When I drive through New Mexico, I don't see a lot of prosperity, and I don't see a ton of happy fathers, working fathers. You want me to run down the list of the other worst states? Because they're
Yes.
all states that these are states full of people simpatico to our way of our political persuasions.
Okay. Well,
Num- the
I'm
number two,
waiting. I'm waiting to hear number two.
number two, West Virginia. Number three, Mississippi. Number four, Louisiana. Number five, Nevada. Number six, Alabama. Number seven, beloved to me, I don't know how many other people, but to me, Oklahoma. Number eight, South Carolina, and then Arkansas and Idaho. None of those states are, except maybe New Mexico, is an area that I wouldn't mind living if I had to,
Right.
based on
Yeah.
the voting patterns and so forth and so on.
No, no, I totally agree with you.
So let's go to the best states for working dads, the very, very best,
Oh,
the
let
most
me guess.
wonderful.
Massachusetts.
Number one, Massachusetts. Bingo.
I
Good
knew
for
it.
you. Good for you. And number two is a place that's a
Now I'm lost.
it's a teeny little place. It's even smaller than
Maine.
nope, it's even smaller than Rhode Island.
And let's Connecticut.
Close. Connecticut's number three on this list. District of Columbia.
I never think of them as a state.
No, but they do. Wallet Hub does, and they want to throw them right in there because, frankly, it's another tick on their list of wonderful, heavenly places for working fathers to live. I'm not so sure that that's accurate, but three is Connecticut. Number four, Rhode Island. Those two are like Siamese twins. Number five, New Jersey. Number six, Minnesota with Tampon Tim, what's his name?
Minnesota.
Minnesota. Wisconsin, Illinois with Pugsley, New Hampshire, and Maryland, where our ex-president, our most recent ex-president lives.
Yes, it's just how is it that we have identified this bias so quickly? I mean, it's really hidden just several feet under the surface, but
How many of
we
these did
found
we
it.
go through? Yeah, we did
We
find it.
we found it in one of the early ones, and we've been through a few of these, and guess what? It does not change from
It is.
quiz to quiz.
It is very, very consistent. The only time I remember any deviation from that particular bias was when they were talking about where it's better to start your career. And they accidentally took an honesty pill, and the best places to start your career were not the places where they like to live and vote.
True. Yeah, I do remember that one. I do remember that one. Well, you know something?
What's
We
that?
we gotta close up shop here.
Oh boy, I had so much more to go here. I don't know what I'm going to do with all this stuff. I guess I'll just have to bring it back for our next episode, huh?
Yeah, yeah. Well, you paid for it, by from the curator, so you don't want to waste that money.
I do not. I do not. So can you dance us on out of here?
I can, but there's no dancing lessons available, so I don't
Well,
know
not
how,
free
I
ones.
don't,
Not
I
free
no
ones
free
anyway.
dancing lessons, I'm telling you. So anyway, here we go. Here we go. Write this email address down because it's going to be important to you someday. dbj@mlmmailbag.com. You could reach out to Doug and ask a question, make a comment. He'll be waiting for that email. Next one. Doug is licensed in every state of the union to help you make your choices in the Medicare supplement arena. Medicare for the lazy man. That's where we live on the World Wide Web. There's some good stuff there. I think I think it's pretty nice to visit, if I do say so myself, because my wife and I wrote it. Oh, okay. Did I say that?
You did out
Okay,
loud? Yes.
out loud, yeah, or in my out loud voice, yes. And while you're wandering through the internet, find a place to drop a review for all the work that Doug does. It's amazingly important work, and I'm telling you, it's not that hard to drop a review. And we want to win. We want to stay ahead of the travel logs. And someday I'm going to ask Doug to explain that. But just mark that down. Mark that down. I will ask him. I will remember to ask him about that desire to stay ahead of the travel logs soon.
And I will explain
Last
it.
but oh yes, absolutely. Last but certainly not least, thank you for joining us today. We're glad you were here rather than someplace else, but I know darn well if you did have your watch on, you were ignoring it because the content just absolutely sucks you in. I know that's why it is. We have just spent about 32 and a half minutes with Doug Jones, the insurance guy, originally from Oklahoma. No more. He's living out in the low ground of Illinois. I think well, he told me, he can correct this if I'm wrong. It's right next to Pugsleyville.
It's
And
it's in the middle of Pugsleyville. The whole
it's
damn
it's
state is.
it's in the middle of Pugsleyville, and bottom line is I'm not sure I'd want to live there, but Doug has got this beautiful, beautiful homestead out there, and I'd love to live in it, but Doug won't let me anywhere close to it. I've already asked.
Stay out. I'm protecting you from Pugsley.
Thank you. I'll take that. So here we
Alrighty.
go. I'm gonna turn it over to Doug, and he can march it. Well, no, he's gonna dance us out through
Yeah,
this
but I'm
thing.
not going to get it for free. So thank you, Randy, and thank you, ladies and gentlemen, for joining us. I'm hoping that you all come back for our next episode. Maybe we'll finagle some free dancing lessons by then. That's Randy's fervent hope, and it will be mine too. So I'll look forward to seeing you at our next episode. Bye bye.